Alright, so before we begin talking about the treatments of amoebiasis, it's good that we take time and have an overlook or overview, alright, of the whole disease condition, of the amoebiasis disease condition, how it is caused by Entamoeba, histolytica, and all of those talks. So for amoebiasis, let's quickly move. We said that it's caused by Entamoeba histolytica, that's established. We said that it's caused by Entamoeba histolytica, so it's produced by what? Ingestion of their cysts, through water or food that has been contaminated with feces. So water or food that has been contaminated with feces. All right. So the cysts are in relative inactive, that's dormant form. You understand? They can live for several months in the soil or environment where they were deposited in feces. So primary site of infestation is intestines. However, amoebas may migrate to other tissues more frequently, the liver. So the cyst, when ingested, becomes active, transformed into trophozoites, and they reside in large intestines. So there they multiply by repeated divisions, and they invade the mucosa and submucosa of the intestines, causing ulcers, amoebic dysentery, which often occurs when bloody stools often occurs with bloody stools and sometimes cause amoeboma. That's like a tumor growth of that. So this is referred to as the invasive intestinal amoebiasis. So sometimes the trophozoites transformed into cysts, which may remain in the intestinal lumen, or pass out in feces. So this form is asymptomatic and is referred to as a non-invasive amoebiasis. So the next thing we have here is some trophozoite may enter systemic circulation and invade liver. So this can lead to liver diseases like liver abscess. They may also invade the lungs, the heart, the brain, the cutaneous areas, right, causing amoebic lung abscess, amoebic pericarditis, amoebic brain abscess, and cutaneous amoebiasis respectively. So this is referred to as the hepatic or intraintestinal amoebiasis. So, but on the general, what are the signs and symptoms of amoebiasis? A person that has amoebiasis, there will be a lot of diarrhea in that. Lots of diarrhea, stomach pain, loss of weight, appetite. So most amoebiasis are without any significant symptoms. Some of them are asymptomatic. So harmless strains of parasite, Entamoeba dispar, they do not cause any toxic symptoms though. So complications of amoebiasis, it can cause anemia, breakdown of red blood cells, then liver, brain, and lung abscess. So symptoms of liver abscess may include things like fever, nausea, vomiting, pain in the upper right portion of the abdomen, and you can also have an enlarged liver. Amoeboma is kind of like a large lesion of the bowel. The rectal rational fistula, bloody dysentery, then also there can be inflammation of the peritoneum, peritonitis. So diagnosis is this. The specific symptoms of this, you are trying to pick out things like diarrhea or loose stools. You are trying to pick out blood and mucus in stool. You are trying to do all this laboratory analysis just to dictate the presence of the causative organism, which is Entamoeba histolytica. You are doing things like enzyme-linked immunosorbent assays, then colonoscopy of the large intestine to search for the parasite, ultrasound or computerized tomography scan of the liver can all help. Alright, so this is a complication in the stomach, can lead to intestinal perforation. So medications. There's pharmacological therapy, alright, where you basically use drugs against amoebiasis like albendazole, mebendazole, praziquantel. Surgical interventions can also help. Then preventive measures can help to stop the condition before it even comes in. Alright, so that's just it for the amoebiasis introduction. See you guys.